Welcome to the IDEX Continuing Education Series.
Welcome everybody. My name's Dr. David Mason, and I'm going to be talking to everybody today just about preventative healthcare, standards of care, and how we look at actually what are they and how we actually look at implementing them within a GP veterinary practice setting. So our agenda topics for today, certainly what are standards of care? Why are they important? How do we implement standards of care? And then beyond that, how do we look at implementing preventative standards of care and preventative healthcare plans? And then we can talk about some wellness plans and some accreditation options. And really what I'd like to get out at the end of this is to give you guys some strategies in terms of what are some tools you can take away to actually look at implementing standards of care and preventative healthcare into your hospital. So really want to look at, what is standards of care? So what are standards of care? To me, standards of care are a consistent best practice animal healthcare approach that's been delivered by the whole team. They're a standard of care that is delivered by the whole team, and everybody's then accountable to maintain these standards. And that is critical if we're looking at what is a standard. It's something that everybody believes in, it's something that everybody's engaged with and how they're developed. We talk about standards of care a lot in the veterinary profession, and this is a term that can have quite different meanings depending on who you're talking to, and it's really important when you talk to your team, you actually have a pretty solid idea as to what do you mean when you talk about a standard of care. Is this a minimum standard? Or is this an ideal aspirational standard? And I guess, is it a minimum standard? Is what we're going to talk about here is, do all our patients go home with pain relief from a dissecting procedure? That's a minimum standard. There's no exceptions to that. Every patient, every time. An ideal or aspirational standard might be this is what we actually want them to have when they're going home, but that may not always be appropriate. And then we're all well aware of cost constraints and various different things that can inhibit us as a professional to be able to deliver our sort of ideal standard of care, but we need to be aware of what they are and how they're going to fit in. Some examples of some ideal standards of care. So the ASAV standard of care, this was developed quite a number of years ago, was a standard of care related to the regular health check standards for dogs and cats. It's an aspirational standard of care. It sets out the highest possible standards of care that is evidence-based, that they're looking at when you're doing a regular health check for cat and dogs. And not every owner is going to want to be involved in every aspect detailed here, but it's something that we should be using as that part of that checklist and to be aware. And it's certainly there as a standard. And this is a bit of an example of the things that they've included within that standard of care of regular health checks. So there's a whole list of elements here on the left-hand side. What age groups do we think they need to be involved in? But most importantly, when we're looking at developing this and we're trying to talk to professionals with our nurses and our vets, is that there's evidence, and here's the references. So when the ASAB have developed this standard of care, they've actually referenced all of these different features and things that we want to be looking at. The newer one that's come out just a couple of years ago was the standard of care related to anaesthesia guidelines for cats and dogs. So this was a published paper in the ABJ written by Leon Warren as the key author. And you can see there that it says the standards set out in this document detail the ideal standards of anaesthetic care for dogs and cats. So you need to be aware of what they are, and you need to be across what's currently available. So why do standards of care get a bad reputation? And if we're talking about preventative healthcare plans and standards of care, they're often belittled and people don't know what they're being communicated with, and it's just because of that confusion between what's an aspirational standard and what's a minimum standard. And then how do we communicate them with our team? How do we make sure get our team engaged with what we're trying to look at? Do we mention the revenue that's going to come from these procedures? Do we mention just the procedures? We need to be really careful that because of the poor communication, that there are some vets and some veterinary clinics and some veterinary teams that feel that standards of care are just a big stick and they need to be trying to help them to sell more. And that's not what it's all about. For me, standards of care is about clinical standards, about accountability, and it's about celebrating success just as important as it is for looking where we can improve. And we need to, that's a holistic approach for the team. And that accountability is really critical. So why do we need a standard of care? And this is, again, something, if you're looking at it for the first time and you're trying to consider what we're looking at doing and you've heard this term standard of care and people are wondering what's actually going on, Well, we know that clients want the best for their animals. We want to be able to offer the highest possible standards every time, and really just not what we can get away with, which is not certainly not the ideal and not what I would want for my pet. And if it's not something that I would want for my pet, then I don't believe it's something my clients would want for their pets. People's pets all have different significance to them. We always should be offering them the best. It's also really important that we have a consistent message across the team, and that our nursing team, our animal caretakers, and our reception team know what these standards are. And then they can hold the vets to be account. Like, nurses are really good at ensuring that, okay, we've said this is going to be our standard of care when it comes to pre-anaesthetic blood testing or fluids during surgery, monitoring of anaesthetics. They will make sure that we do it each and every time, and make sure that the vets are doing the right thing, that we're all holding each other to account. So ultimately, who is responsible for standards of care? It's our client relations, it's our nurses, it's our animal caretakers, our animal attendants, it's our vets, and it's our managers. A standard of care is a whole hospital approach. So how do you make this happen? Really key is that standards of care need to be owned by the staff. These are parameters that we use to ensure that all of our patients have the highest possible level of care. So there's a couple of different ways. When we looked at doing it, when I was part of the Adelaide vet team, we had a couple of different ways we could look at introducing standards of care into our practice. One is you can look at a sort of a slow uptake. So you just introduce it step by step. This is just a new thing. We're going to introduce it one at a time, and over time, and you get the staff buy-in and acceptance and understanding of why you're trying to do what you need to do. The alternative is you create try and shake up the team and create that paradigm shift, which actually gets you to create a whole new set of changes at once. Both have got pros and cons. The latter one there is often where you look to get somebody in who can really challenge the team about why they're doing what they're doing. And you need to decide for your hospital what's going to be the best sort of approach. But the key is the staff need to understand and engage with why you're trying to look at doing what you're trying to do. And that's because you're trying to increase the standard of care that we're providing to our patients. So we need systems to make sure the standard is easy to implement and it's just part of a what we do approach. To make this happen, there's a whole variety of things you want to look at. There's not going to be one size fits all for every standard, and there's certainly going to be a variety of things that you might want to put in place to ensure that you're actually meeting these. But things like written protocols, these need to be written down. We can do role plays, we can do mystery shopping, depending on what the circumstances are. We're reviewing how things are going and why we're trying to do it. And what we're going to talk about later in this conversation is how we can create some programs to try and make this a little bit easier. So things like wellness plans, senior packages, fear-free, they're all opportunities where you can create something that's going to help your team to get engaged further. So at Adelaide Vet, what we would do is we had a weekly staff meeting for all staff. So it was an hour and a half on a Wednesday. Half of that was housekeeping and half of that was training. Every couple of months, we got all the vets together after hours and we sat down and talked about standards of care and training. And this is where the vets who've been away to conferences can bring back the ideas that they've looked at. What have they done? What do we do well? What do we want to continue doing? What are we going to stop doing? What are we going to change? Do we need to review one of our standards of care or our clinical policies and our protocols and look at how we can improve what we're actually doing? And the other big part for me too is performance reviews. So actually catching up with the staff on a regular basis. So trying to touch base with them. How are they going personally? Where are they at? What are they looking to develop? Do they understand what we're trying to achieve with our standards of care? So at Adelaide Vet, our standards of care that we developed were developed around what I'd call evidence-based, where possible, best practice. And not everything, as we're well aware in the veterinary profession, is evidence-based, just because there's the lack of evidence for a lot of things going on. But we want to look at, well, what is, if we haven't got the evidence, what is best practice? How are we going to look at consults and things? So these are the sorts of things we would talk about. We would do 6-monthly visits for consults. We would do full examinations for standard consults. And this was a big one for us. So just not addressing that client's concern, but actually doing the full health check if they came in for a standard consult. So this is, obviously examining the whole patients that come in for the sore ear, that come in for a lame leg, do the whole health check, have a look back through the patient records. One of the things we used to get a lot of complaints about was the patient had been in, they would come in for health check for their sore ear or something, we'd put them on an ear treatment, We'd fix the problem, and then 2 weeks later they'd get a reminder for their vaccination or their worming, and they're like, "I was just in. Why didn't you look at that?" And well, it's because we didn't take the time in that initial consult to actually see, well, what's happening with the whole patient rather than just what's their own concern. We want to talk about preventative health, so vaccinations and worming, and I'll talk about these things a little bit later. Wellness plans, blood tests, dental staging, not grading. Dental, I always want to talk about dental staging because stages develop. Things have developed from stage 1 to stage 2, whereas grades tend to be absolute, and staging tends to imply to owners that if I don't address the grade 2 dental, it's going to stage 2 dental, it's going to then progress to a stage 3 dental, and that's just an important differential going on. And then finally, we looked at it in terms of how do we hold ourselves to be accountable, and ASAVA hospital accreditation, feline-friendly hospital status, all makes a difference in terms of, well, okay, I've said it, this is the thing that I do. I'm going to hold myself up to be accountable. I'm going to make sure my team holds me to be accountable as one of the leaders in terms of how do we actually bring this to fruition and make sure that this is something that we actually want to do. So standards of care, I really want to get across this concept that standards of care are not a static item. We don't just set and forget. Standards of care are dynamic, and we're always reviewing what we're doing. So we want to consider is, what are our standards of care? What is the objectives? What are we actually trying to achieve here? What is best practice? What is evidence-based? Am I being the patient advocate that I'd like to be? And what do I want from my patient? What would I want in this particular set of circumstances? Then I want to, because I'm a vet and because I tend to be somebody who's evidence-based, I want to actually look and see what's the evidence there. Let's have a look at the conferences, the journals, the pharmaceutical company information. Let's run a critical eye over it and consider, well, what's the best thing that we could be doing? Then I'm going to look at how I'm going to implement this. And this is the circular approach. I'm going to go, well, okay, I'm going to implementation. So what training is required? What differential, do I need any different equipment? Do I need any different medications? What protocols do I need in the clinic for managing this situation? And what KPIs? What are really going to matter? How am I going to prioritize these? And am I going to have a standard of care related to the team? And how does the team get involved? And how are we going to reflect on this? So if we take a little example for this, if we wanted to introduce a standard of care or a preventative healthcare measure that said, we should be doing a blood test for all patients over 7 years of age, because that's what I've heard is a good idea. Well, why am I going to do it? What is our standard of care related to that? Let's look at the evidence. Is this something we should be doing? Should we be doing it for all patients? Should we be doing it just for our senior patients? What blood tests should we be running if we're going to look at doing that? How are we actually going to ensure that we're doing the most appropriate thing, given the current evidence and literature, in terms of running a preventative blood test screening program? How will we implement it? So, okay, how am I going to train and develop? Do I need any different equipment? Probably not, but do I need some protocols in the clinic? Absolutely. And then, can I measure it? Are we going to actually measure the pathology test? Have I got in my practice management system a means where I can measure the things that I'm actually trying to put into place? Have I got my products and services within my PMS structured in a way that is actually traceable and trackable for these sorts of things? And then we're going to look at the team members. So we're going to get the team member involvement. This is something we might look at the vets. Are the different vets actually engaged in it? How well are they engaged? If they're really engaged, fantastic. If they're not engaged, well, why not? What's actually going on in that particular set of circumstances? So when I looked at standards of care and what we did at Adelaide Vet, so standards of care documentation is dynamic. It's continuously being updated and improved. It's supported with ongoing whole staff training, and we measured regularly with KPIs and staff meetings. So this was a bit of our dashboard that we would look at. We would look at primary visits and revenue and wellness plans and imaging and things. We would look at dentals. We'd look at actual dental numbers, number of dentals per primary visits, and this was looking at it on a regular basis. And I look at then pathology testing. And if we talked about pathology tests, how many are we doing? And then I'd break this up by clinic, I'd break this up by vet, and we could look at our internal versus external pathology and just try to get a bit of a handle as to, okay, this is what's going on. And then within our team, well, what are our benchmarks? What are our goals? If we're going to look at creating a program or a plan, what do we need to actually bring this to fruition? So it's an inclusive culture, trying to get everybody to talk about it, and always working towards what's best practice. So what are some of the tools we can do? For me, the key for creating a standard of care is to get it written down. So basic sorts of things, and I'd go back and use that ASAV standard of care related to the general health fix as a really good starting document to look at. Not that you're going to necessarily adopt all of those, but you're going to use that as a reference point and go, well, this is the things I'm going to consider for my hospital. So vaccinations, what are we going to do? I went and did a locum work in a 4-vet hospital, and the receptionist told me at least 5 different vaccination protocols they had in their hospital. How are they meant to communicate that to the team? How are they meant to communicate that to owners in terms of what I'm meant to be doing? So what's a vaccination policy? What happens if the vaccinations lapse for 3 months or 6 months? Do we have a consistent message? Do we talk about theatre testing? What are we doing with routine worming? Are we doing worming, or are we doing fecal floats? Your IDEX fecal float check at home collection kit. It's a really good thing that you can use if you want to do regular fecal floats. Am I aware of it? Heartworm regime, what's happening? Tick, please, puppy kitten consults, what do they include, what do they not include? But let's just get some agreement and write them down. That becomes really critical. Then for clinical case management, do the vets agree and have a policy on our iris staging, our dental staging, our routine pain management choices, our pre-anaesthetic blood testing, our electrolyte tests for patients on IV fluids, the responsible use of antibiotics, our hospital patient care? These are all things that are going to impact us every day as working in a busy veterinary hospital. But if we've got a team that's working there and they're not actually even understanding how we're going to stage our dentals, what is it defined as a stage 2 versus a stage 3, that becomes really problematic and critical. Client standards. Do we have client standards of care? Do we have a standard of care that relates to communication standards, frequency, greeting, support? What are we looking to achieve? There are some great resources for those looking to start this process. The IDEX website's got some really good things on the Vet Hub. There's good published papers now that start talking about why we should be doing this. These are evidence-based, peer-reviewed documentation that actually supports the creation of a standard of care and how that's going to get involved. The key is to make it real. So staff really need to understand why. So again, there's things here, there's some great tools available in terms of promoting preventative healthcare, how to talk to clients about preventative screening, checking your progress, tips and tricks along the way. But the key is the staff need to be engaged, the staff need to understand why we're looking to do this, and if they understand that, then they're not going to be putting up barriers to this becoming something that you do on a routine basis in your hospital. Certainly some of the barriers that can be seen, but it feels like selling. Every case is different. We can't have a standardized approach. That's not my job. It's not the way we've always done it. So a few ideas to help with this, but we can build a package. Some things like wellness plans are much easier for the team to understand that value. We can create some promotions, and let's just try and test it. Let's try a preventative healthcare promotion for seniors. Let's do something and see if that engages people. Let's see if our team actually can follow on. And can we hold ourselves to be accountable using an external program such as accreditation, ISFM, ASAV, fear-free or stress-free cover, to actually ensure that we are holding ourselves at that highest possible standard of care? So moving along. So the second part of this talk, what I really wanted to talk about was some strategies for the implementations of standards of care. So a lot of you all have heard of wellness plans, and I just want to talk a little bit about wellness plans and why you might want to consider developing a wellness plan as part of your hospital standard of care and preventative healthcare. There are lots of different standards of care and lots of different wellness plans out there, and the easiest thing to do is go and have a look and see what everybody else is doing. Here's one where they look at, they get your annual vaccinations, consults, worming, flea control, heartworm. They get some costs towards professional services, monthly payment plans. It makes it easy. The Green Cross have got their Healthy Pets Plus. The Pet Practice have got wellness plans as well. And the Banfield team have got over in the US, there's a big veterinary group over there. We've got a whole bunch of wellness plans as well. And why are all these hospitals looking to do this? Because they're creating a bundle as an easy way for the clinic to package together all those things that I and my team agree are critical for the patient's best outcome. Clients like for things to be easy. They like to know that you have got their patient's best interest. So when you can talk about it, it creates, you've got this bundle, you've got this product, it's then able to help create that loyalty for the client. The staff understand that value and promote the plans because they see the value in their patients coming back in regularly. They can see the value in ensuring that their patients that they see regularly are having all the things that they would like to have for their pet. And it is a little bit cliche, but these are the things that the patients need. You've agreed it upon as the team as these are the things that the patient needs, so this is what it needs. So wellness plans. Wellness plans for veterinary practice create a system of implementing a standard of care. They advocate to clients a simple and cost-effective solution to patient healthcare. And the nurses don't sell the plan, the vet starts selling the plan. They believe in it because it provides value to the client. So your wellness plan, and when we did it at Adelaide Vet, the clients signed up on value, but they re-signed back on convenience, and that made it really easy. Trying to get clients in regularly, they bonded to the practice, they understood, you're removing that barrier of a consultation. So when we at Adelaide Vet introduced free consults, or as consults weren't free, but they're actually included as part of that plan, what it suddenly meant is that we were seeing patients in much sooner for problems. So patients coming in with they've just noticed a small lump, or they've noticed that it's a little bit sore, or it's got this bit of a skin problem, and they were easy to deal with. They hadn't been left to fester, they hadn't been left to go on. The owners weren't stressing and worrying about it, not worried about the fact that they've found a little lump in the dog and they're not sure if it's a lipoma or if it's something nasty and should I get it checked or shouldn't I? I'm worried about what it's going to cost for things. And what you also find in that situation is the clients are coming in and they're not paying for a consult. That consult's already been paid for upfront. They're already well aware of that. And it gives you a much better chance to actually talk to the donor and do what they need to do. And these clients are engaged. They really want to do things that help them feel better about their pets. And the end result is that they do tend to do a lot more. So this is way back in 2015, but our TWP patients would be doing a lot more. They're far more prepared to actually spend money to make sure that their pets stayed healthy and would look after those small problems and investigate them earlier and sooner. And that means your patients live longer, the patients have a better quality of life, the owners are much happier about the quality of life that they've got with their pet and that relationship that they have with their pet, and that becomes critical. So standards of care wellness plans is one simple thing that you can look at doing to introduce into your practice. We can look at senior promos. So senior promos, adult wellness promos, call it what you will. These are another way to look at introducing wellness or preventative health checks, preventative healthcare standards to your pets. So again, this is one that I was involved with. Winter health packages, look at the cost of this. You can easily see the value in it. The nursing staff see the huge value that they're providing to the client. They're not having to sell the product. It was something that aligned with our hospital standards of care. Our standard of care was that we should be doing an annual blood test for our senior pets. And it was an easy thing for people to be engaged with. This was the nurses said, well, this is something we should be doing, and now we're going to make it cheaper and easier for you to do it. Come in, let's have this blood test and hopefully ensure that your patient is well. And teaching the staff that a negative or a normal result in this situation is actually a really good outcome for us. But if we did find something, then let's take that early opportunity to try and identify it and work on it and ensure that the pets remain as healthy as possible, and that early intervention gives us a better possible outcome. Again, we looked at the evidence. There's good studies. The Delorsa study published in the AVJ had some really interesting numbers of 6.2% of healthy adult dogs had significant changes in wellness bloods. And the AHA study, so this was a metadata analysis, more than 260,000 patients across 5,000 clinics. And if you look at it, there's some pretty rigorous data management to ensure that what is actually defined as being an abnormal result. And we sat down there, and as a veterinary team, we looked at it and said, do we actually have confidence in what this is? Yes, we do. Okay, this is something real. Let's start looking at it. So we did a senior promo. We included consults. We did some basic blood tests with our chem teams, our ProSite, CBC, and UA. And for us, we decided it was going to be plus or minus a T4. And when I ran these numbers, the cost was $115. And yeah, if you do it year on year, you start to get better numbers happening. Over time, the staff engage further. They can relate and communicate to the promotion to the clients more easily. They're just aware of it. Okay, we're coming back to the senior promo. If you start repeating these promotions and repeating these standards of care, it becomes much easier for the team to actually talk about them. They're not trying to sell them. They're actually just providing clients with the information that's going to ensure that their clients that they see have the best possible outcome. The value of these clients to the business was very high. Abnormalities on routine bloods were discovered, and these required workup. And it creates a baseline value for year-on-year results. And again, this was part of our standard of care. We should be doing regular checks. For everybody who's using the Vet Connect Plus, they're well aware of this, but if anybody's not, then trending in results is a really critical thing that's happening. And what we can see if you start checking on things is that suddenly we've got an IDEX SDMA that's been tricking along for a couple of years, and now it's suddenly jumped up. Well, what's caused that to jump up? Why have we had this change that's gone on? Let's do some investigation and actually ensure that we haven't got early renal insufficiency occurring. So, or we might just want to check it. So, but there's a lot of power in being able to trend and see this patient's life cycle. Another tool you can use is accreditation. Accreditation, to my mind, is about holding yourself and your team up to be accountable. And it's about saying, well, this is the thing that I'm doing. Now I'm actually going to get somebody external to come in and actually check and validate, peer review to make sure that what I'm doing is actually a great thing. So for those looking to embark on accreditation, ISFM is often is a great place to start. Our cats, people are well aware that our cats aren't small dogs. Our cats need this particular set of environmental conditions. They need a different approach to being handled and managed. And our clients really appreciate that as well. So the ISFM accreditation, the cat-friendly clinical organisation, is an international accreditation program that helps ensure ongoing accountability to agreed minimum standard of patient healthcare. You need to create that hospital champion. You get different levels of accreditation based on what the clinic's physical structure is. So you can have gold, silver, and bronze levels of accreditation, and create a benchmark. Like if I'm going to look at doing some renovations, so I'm going to build a new consult ward, or I'm going to renovate my consult ward, well, what can I do that might actually mean that I can either become accredited, or something that might mean I can increase the standard of accreditation that I've got. And that's really powerful in terms of the hospital team actually getting an understanding of what they can do. Another form, which is sort of a next level again, is that ASAV, Hospitals of Excellence Accreditation. So the Accredited Veterinary Hospital Scheme, the key for me is understanding the purpose of this accreditation is not to create more clients and create more money. The purpose of accreditation is to help you set a benchmark within your own hospital and to hold yourself to be accountable. It's a culture carrier. It's a mechanism for actually helping the team to improve themselves. So it's a peer review process. Like I said, we're trying to drive culture. We're driven by the team. All staff are going to be responsible, and forces us to individually look at what we do and hold the whole team to be accountable. So what's actually involved in the ASAV Hospitals of Excellence Accreditation Program? So what we're going to do, they're going to look at your medical records. So you're going to submit some medical records. You're going, and again, just there's detailed documentation about what these medical records should be. But if I'm holding myself out there, then are my medical records up to standard? Do they follow a standard SOAP or HEAP format? Do they mention the drugs properly? Do they actually provide commentary around that patient interaction, the client communications and things like that? Have I documented anaesthetic records and that sort of scenario as well? So are my medical records at a standard that I'm actually proud to show to somebody else? They're going to look at some x-rays. And again, we send the x-rays go off. So the medical records get reviewed by a medicine specialist. that radiographics records get reviewed by a radiologist. And again, for neither of these are actually about what was your diagnosis, because that's not important in this situation. What's important is the thought process and the actual documents at a standard that's appropriate. Have I got a differential diagnosis with my radiographic records? Have I actually recorded in the medical notes the sufficient level of details that is related to those x-rays that have been taken? Are my x-rays of a suitable standard? And the final part of an inspection process is that on-site inspection. An inspector will come round. They're typically somebody who's got an accredited hospital, they've been involved in the ASAV, and they've had a fair bit of experience in what it means to be an accredited hospital. And the process here is to try and help and support clinics to become a better process, better team. And then when I'm looking at a hospital accreditation, it means that for every 4 years, it's time to take stock, stop and look at my hospital, look at what I'm doing, how am I doing it, and is there anything that needed to be improved? Simple things like when I was with Adelaide Vet, every 4 years, the hospital would get painted internally because things start to get a bit tired. It helps make sure you sort of coming around again, the consults walls get a bit of a battering. Are they up to a standard that makes me look like I'm practicing best practice? And it's definitely a team approach. This is something where I would allocate out to everybody in the hospital an area of responsibility to do. So everybody from an animal attendant to a receptionist to the practice manager to the vets all have things that they need to be party to. And then they take a lot of pride in actually making sure that that area is up to standard, that the policies and procedures that relate to that particular area are relevant, and that the team, after this inspection process, are continuing to maintain that standard. And that becomes really critical. Patient mental health. This is a massive area that's becoming more and more important in veterinary surgery science at the moment. Anxiety, patient stress. What am I looking to do? So it's a big concern. It's a major reason many owners don't want to bring their pets into hospital. It's certainly interesting to note that as we talk about this at the COVID times at the moment, that the number of cats seeing vets has actually increased because of the use of telemedicine. And that's really interesting. It's just showing that our cat clients it's not that they don't want the healthcare needs of their pet assessed, it's just that the act of bringing their pet into the clinic is actually quite a stressful process, and we need to be well aware of that. And we need to be doing what we can to reduce that. So fear-free and stress-free are two starting points that we can look at. We need to get some staff training on pet anxiety and stress. We need to look at is what we're actually talking to our clients about the most appropriate thing. Are we still up to standard? Do we still talk about dominance in the consult room or in the vet clinic? Or have we ensured that we've debunked that? There's good evidence there that that doesn't exist. Where are we actually doing? What are we looking to achieve? Standards of care, so a fear-free program. So fear-free and stress-free are both registered programs in terms of teaching you and your team about how to reduce the level of stress and anxiety in my pets that come into the clinic. Talking about pet transport, waiting rooms and reception areas, how can I change them around a little bit to make them less stressful? In the consult room, keeping an emotional record. Do I have an emotional record attached to my patient medical record? Am I using DAP and Fairlyway? What else am I looking at doing? For my hospital care, how do I make sure my patients that are having to spend time in hospital are as comfortable as possible? And therapeutics. Do I need to look at medications to help reduce that level of anxiety before the consult, during the hospital stay, when patients go home? And again, there's whole heaps of examples of this. This is one program that we were looking to do that worked really, really well. There's a whole variety of these, but typically you're going to have some medications that you can supply to pets at a relatively inexpensive cost that can help reduce their stress levels when they come into the clinic. And we've managed this so it complies with all the legislative requirements, but it actually means I've got a pathway to actually reduce the stress levels of pets coming to the hospital. And for me, when we started doing this, the best advocates were the nurses. They were really well and truly in tune with the pets that were really stressed. They were the ones that were advocating for it. They were the ones that would be talking to me as the vet in consult, saying that I think this this pet needs to go home with some fear-free meds, or it needs to come in. It's coming in for a procedure. Let's make sure it's got something on board before it comes in for its hospital stay. So again, we did the training. We get somebody in who's got some skills and expertise in this area. We're doing that mental health assessment as part of the patient exam, patient clinical exam. Anxiety, we're making it's just part of something you're doing on a day-to-day basis. And it's not just sedating them, but using medications to try and reduce their anxiety, maybe provide some amnesia, maybe try and make them a little bit more comfortable about that situation that's going on. So these are all things, these tools that we can use to try and build on to create that standard of care or preventative healthcare planning. So we can look at setting ourselves up in terms of creating a wellness plan that includes all the things that we might want to consider. We can look at creating, getting engaged with a promotion of some sort. So senior promo, looking at regular blood tests. Is there something else that I'd like to include that's going to help me reinforce and value the actual standard of care that I've got? Can I look at some sort of accreditation process? So standards of care and preventative healthcare planning is a workplace culture. This is just part of what you do. It's become something you live and breathe every day. It's not something that is just done every day. It needs to be evidence-based. You need to regularly measure it, you need to review it, and then you need to improve it. And I talk to my staff about the fact that when they go, whatever conference they go and listen to a webinar, when they come back, what's the one thing we should be changing? What's the one thing we should be improving? What do I need to do a little bit differently to actually meet and continuously improve and review my patients' standards of care? Make sure everybody's responsible. It's not just up to the practice manager or the senior vet. Everybody in the clinic is responsible, and everybody's empowered to make sure that everybody else is doing the right thing. So create these programs, wellness plans, fear-free, team implementation, create the standard, get the engagement from your whole team and build it up from the ground up. And everybody's accountable. For me, the key with everybody's accountable is you need to give permission for your staff to hold you to be accountable as well. So if our standard of care was related to the fact that all the senior pets had to have a blood test and I did a consult and I didn't recommend a blood test, then why didn't I do it? What was going on, David? Why didn't you provide that standard of care that you said we all need to be doing and you haven't done it? And you need to give your staff that power to challenge you as one of the leaders in the organisation about this is what's happening. And everybody needs to hold everybody else to accountable. And that just becomes, it then becomes that culture, it then becomes just the norm in terms of at this hospital, when I work in this clinic, these are the things that just happen on a daily basis, and it's not something that I have to push, it's not something I have to implement, it's just something that has always been done. So thank you, everybody. There's gone through a whole bunch of stuff there. Really appreciate your time to listen to these. If you're certainly happy to follow up, and yeah, so the team at IDEX have got some great resources in terms of what's available, and they can help you in terms of moving forward, in terms of looking at actually creating your own preventative healthcare plan. So thank you very much.